Hello, I'm Michael Sanders. I'm a professor of public policy at King's College London, and I am the lead author on a report for the Centre for Homelessness Impact about LGBTQ plus people and their experience of homelessness. One of the things that we find in this paper is that LGBTQ plus people are more likely to experience homelessness than their cisgendered or straight peers. This is something that occurs for a number of reasons, which we go into in the report. And according to Stonewall, about 1 in 5 LGBTQ plus people have experienced homelessness at some stage in their lives. The report looks at the fact that LGBTQ plus people, because they experience higher levels of discrimination and systemic injustice in society, are therefore more likely to experience homelessness because they're more likely to experience discrimination in the workplace or in other facets of their lives. LGBTQ plus people are also more likely to experience traumatic events in their childhood, and they're more likely to be taken into residential or into foster care. This means that they are more likely to be in a situation where, when they become adults, they themselves then go on to experience homelessness, both because of their status as an LGBTQ plus person and the discrimination they experience, but also how those childhood experiences, such as being in care, have effects on their social networks and therefore their likelihood of experiencing homelessness later in life. We also find that LGBTQ plus people are more likely to experience mental health challenges for a number of reasons. These challenges are not caused by them being LGBTQ plus. People who with those characteristics are not inherently more mentally unwell than other people, but other aspects of their experience, for example, again, discrimination and trauma, make that more likely that they will experience mental health challenges. Those mental health challenges, in turn, make it more likely that they experience homelessness, either because it makes it more difficult for them to sustain a tenancy, or because they are more likely to spend time in an institution such as a psychiatric institution, which again in turn contributes to the likelihood that they experience homelessness. At the moment, the evidence base of what we can do to better support LGBTQ plus people to avoid homelessness and to end homelessness should they experience it is fairly limited, and that's why in the paper we recommend that more evidence is produced about how we can help this particular group of people. And Pride Month, it's particularly important to remember that there is a great deal more that we can and should do to build an evidence base around how to support everybody in our society, but particularly LGBTQ plus people.